Alzheimer's disease is a brain disorder. It slowly destroys memory and thinking skills. This disease is the most common cause of dementia. Dementia is a general term for a decline in mental ability. This decline interferes with daily life. Alzheimer's damages the brain over time. The damage starts years before symptoms appear. It affects areas of the brain that control memory, language, and thinking. As the disease progresses, more brain cells are damaged. This leads to a decline in function and eventually death. Alzheimer's is a progressive disease. This means it gets worse over time. There is no cure for Alzheimer's. However, there are treatments to help manage symptoms and slow its progression. Early diagnosis and intervention are crucial for improving the quality of life for individuals living with the disease. Understanding Alzheimer's is the first step toward raising awareness and finding a cure. It is a complex disease that requires ongoing research and support. Together we can make a difference in the lives of those affected by Alzheimer's. Alzheimer's disease typically affects people over 65. Early-onset Alzheimer's can occur earlier in life. The most common early symptom is difficulty remembering new information. Alzheimer's affects the part of the brain that forms new memories. Other symptoms include forgetting important dates or events. People may ask the same questions repeatedly. They might misplace things and be unable to retrace their steps. Mood and behavior changes are common as the disease progresses. Difficulty completing familiar tasks is another warning sign. This could include driving to a familiar location or preparing a meal. Challenges with problem-solving and decision-making also arise. Language problems such as difficulty following conversations or finding the right words are common. Experiencing some of these symptoms doesn't necessarily mean someone has Alzheimer's. These symptoms can be caused by other conditions. It's crucial to see a doctor if you notice any of these signs. Early diagnosis is key to managing symptoms and planning for the future. The exact causes of Alzheimer's disease are not fully understood. It results from a complex interplay of genetic, lifestyle, and environmental factors. Age is the most significant risk factor. Family history also plays a role. Certain genes increase the risk. Lifestyle factors are important too. Conditions like heart disease and diabetes may increase the risk. Head injuries are linked to higher risk. Researchers continue to investigate other potential risk factors. Diagnosing Alzheimer's disease is a process. There is no single test to confirm the diagnosis. Doctors use a combination of methods to make a diagnosis. The first step is a medical history review. Doctors ask about symptoms, medical conditions, and family history. They will also conduct a physical and neurological exam. This helps assess overall health and cognitive function. Cognitive and memory testing is an important part of the diagnosis. These tests evaluate memory, problem-solving, language, and other thinking skills. Brain imaging scans such as MRI or CT scans may be used. These scans can help rule out other conditions that can cause similar symptoms. Doctors may also order blood tests to rule out other medical conditions. They might recommend a spinal tap. This procedure collects cerebrospinal fluid, which can be analyzed for markers of Alzheimer's disease. Diagnosing Alzheimer's can be challenging. It requires a comprehensive evaluation and careful consideration of all available information. The stages of Alzheimer's are gradual progression. Alzheimer's disease progresses through different stages. Each stage is marked by a decline in cognitive and functional abilities. The stages are often categorized as mild, moderate, and severe. In the mild stage, individuals may experience memory lapses and difficulty finding words. They may still function independently but start to withdraw from social activities. Changes in mood or personality are common. In the moderate stage, memory loss becomes more pronounced. They may need help with daily activities like dressing and bathing. Behavioral changes, such as wandering and agitation, are common. In the severe stage, individuals become highly dependent on others for care. They may lose the ability to communicate verbally. This stage requires round-the-clock care and support. The progression of Alzheimer's varies from person to person. Alzheimer's and dementia. Understanding the difference. Many people use the terms Alzheimer's and dementia interchangeably. However, they are not the same thing. Dementia is a general term for a decline in mental ability that interferes with daily life. Alzheimer's disease is a specific type of dementia.
It is the most common cause of dementia, accounting for 60 to 80% of cases. Other types of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type of dementia has its own set of symptoms, causes, and treatment approaches. While Alzheimer's disease primarily affects memory, other dementias may affect other cognitive abilities first. For example, vascular dementia often affects thinking speed and judgment more than memory in the early stages. Understanding the difference between Alzheimer's and dementia is crucial for accurate diagnosis and appropriate treatment. If you or a loved one is experiencing cognitive decline, it is important to seek medical attention for a proper evaluation. Navigating the path: treatment and prevention. Currently, there is no cure for Alzheimer's disease. However, there are treatments available to manage symptoms and slow the progression of the disease. These treatments include medications and non-drug approaches. Medications for Alzheimer's work by regulating brain chemicals involved in memory and thinking. These medications can help improve memory, thinking, and language skills in some individuals. Non-drug approaches focus on providing supportive care, cognitive stimulation, and lifestyle modifications. Supportive care involves creating a safe and structured environment for individuals with Alzheimer's. This includes providing assistance with daily activities, ensuring proper nutrition and hydration, and managing behavioral changes. Cognitive stimulation activities, such as puzzles, games, and social interaction, can help maintain cognitive function. Lifestyle modifications, such as regular exercise, a healthy diet, and social engagement, may help reduce the risk of cognitive decline and improve overall brain health. While these modifications may not prevent Alzheimer's entirely, they can contribute to a healthier aging process. A hopeful future. Living with Alzheimer's. Living with Alzheimer's disease can be challenging, both for the individual diagnosed and their loved ones. However, it's important to remember that there is hope. While there is currently no cure, ongoing research continues to shed light on the disease and potential treatments. Advancements in early detection and diagnosis are crucial for improving outcomes. The earlier Alzheimer's is diagnosed, the sooner interventions can be implemented to slow progression and manage symptoms. Researchers are also exploring new drug therapies and non-drug approaches to treat the underlying causes of the disease. Support groups and resources are available to help individuals with Alzheimer's and their families navigate the challenges of the disease. These groups provide a safe and supportive environment for sharing experiences, learning coping mechanisms, and accessing valuable information. Living with Alzheimer's is a journey that requires understanding, compassion, and support. With continued research, increased awareness, and a focus on care and support, we can strive to create a future where individuals with Alzheimer's can live fulfilling lives. If you found this video helpful, please subscribe to our channel and hit the notification bell to stay updated on our latest content. Thank you for watching.